He spent his life caring for the mentally ill. But in the end, he became trapped by his own methods. What went so terribly wrong? In the early 1900s, mental health treatment was harsh and often inhumane. Psychiatric hospitals were overcrowded, with few effective treatments. The patients were often left to suffer in isolation, as doctors searched desperately for new solutions. Dr. Walter Freeman, a neurologist, saw this suffering and believed he could bring new hope. He was determined to find a better way to treat mental illness, unaware of the dangers that lay ahead. Freeman was born in 1895, and after completing his studies at Yale University and the University of Pennsylvania, he trained as a neurologist. He was ambitious and driven by a passion to understand the human brain and how it could be healed. But it was in the world of psychiatry, with its harsh treatments and few effective solutions, that Freeman's career would take a dark turn. In the 1930s, Freeman became aware of the work of Egas Moniz, a Portuguese neurologist who had developed a surgical procedure known as lobotomy. Moniz believed that severe mental illnesses, like schizophrenia and depression, could be treated by cutting specific connections in the brain. The procedure seemed to offer a glimmer of hope to Freeman, who was determined to bring this revolutionary treatment to the United States and refine it for his own patients. In 1936, Freeman partnered with neurosurgeon Dr. James Watts, and together they began performing lobotomies. At first, the procedure was slow and invasive, requiring large holes to be drilled into the skull. The process was laborious, and the results were mixed. But Freeman wasn't satisfied. He wanted to make it faster, easier, and more accessible. Freeman soon developed a new technique, using a long, thin instrument resembling an ice pick, which he inserted through the eye socket to reach the brain. This technique, known as the ice pick lobotomy, allowed him to perform the operation in minutes and without the need for anesthesia. Freeman called it the surgical miracle. In the 1940s and 1950s, Freeman's Lobotomobile, a van fitted with medical equipment, became a symbol of his controversial journey across America. He traveled from small town to small town, performing lobotomies on hundreds of patients, from everyday people to celebrities. Freeman believed he was saving lives, but what he was doing was far from healing. One of Freeman's most infamous patients was Rosemary Kennedy, the sister of President John F. Kennedy. In 1941, at the age of 23, Rosemary underwent a lobotomy performed by Freeman. What was meant to cure her developmental disabilities left her permanently disabled, unable to speak or care for herself. The Kennedy family, once hopeful for her recovery, was devastated. Freeman treated many others, children, adults, even those who today might have been treated with therapy or medications. For many, Freeman's cure left them emotionally and physically damaged. They lost their memories, their personalities, their independence. What Freeman considered a medical breakthrough was, in reality, a dangerous and irreversible procedure that left countless lives shattered. By the 1950s, the development of antipsychotic drugs, such as Thorazine, provided a safer, more effective way to treat mental illness. The medical community began to question the value of lobotomy, and public opposition grew. Freeman, once hailed as a pioneer, now found himself the subject of scorn and professional rejection. In 1967, a patient died during one of Freeman's lobotomy surgeries, and he was officially barred from performing the procedure. His career, built on the promise of salvation through surgery, ended in disgrace. After being ostracized from the medical community, Freeman spent his final years in isolation, his fame now a distant memory. Though he continued to defend his methods, the world had moved on. Did Freeman regret his actions? Or did he continue to believe in the miracle he had created? He died in 1972, largely forgotten by the very field he once tried to revolutionize. In the end, Walter Freeman was trapped by his own ambition, as much a prisoner of his methods as the patients he sought to solve. His life leaves us with a question: how far should we go in the realm of healing?